Thank you, I think. I guess we've already ventured a little bit down the path of this discussion anyway, so part of me thought, well, maybe you actually didn't need me anymore because you've already talked about reformulation. But I think it is important that we do explore a little bit what has been happening. So I'm Kathy Dennis. I'm the Assistant Secretary responsible for the Healthy Living and Food Policy branch. So for my sins, I'm responsible for nutrition, obesity, physical activity, and food policy, both regulatory and non-regulatory. So I sort of figure if I do my job right, we don't need to be here because it's all sorted. Unfortunately, it's not that simple. I wish it was. So I work in the Commonwealth Department of Health, so please ignore the little logo on the top there. As part of the machinery of government under the new government, we actually lost ageing. So we no longer age in the Department of Health. So there's a bit of a queue outside the door of people wanting to come and work with us. That's why I look so good. So today what I'm going to do is talk you through a little bit of the background on the Food and Health Dialogue, an overview of the processes to date, the achievements to date, some of the strengths and challenges of the current process, and some future opportunities. So the Food and Health Dialogue was established in March 2009. It was in response to the 2007 Australian National Children's Nutrition and Physical Activity Survey. And that survey found that many Australian children were consuming high amounts of salt and saturated fat and low amounts of fruit and vegetables. So it was decided that we needed a strategy which enabled a voluntary collaborative approach to the food supply. So what we looked at was bringing together people from government, from the public health sector and from industry to look at a number of key issues. One was food reformulation, another was portion sizing, and the third was consumer messaging. Now the idea of this group was that it was to be non-regulatory, it was to be a collaborative approach, it was to be a voluntary approach. And I must say that to date we have very much focused on the first of those issues, the food reformulation, and that's really what I'm going to talk about a bit more as I move forward. So the dialogue itself is overseen by an executive committee. It has been chaired at ministerial level, and in the past it's been the Commonwealth Parliamentary Secretary who's responsible for food. We now have an Assistant Minister responsible for food, and it's had representation from across industry, from some of the NGOs and from government. So the Australian Food and Grocery Council obviously have been a key member, along with Woolworths representing more the retailer side of things, and a representative from the Quick Service Restaurant Forum. The National Heart Foundation has been instrumental in this space, as have the CSIRO and the Public Health Association of Australia, state and territory representation, and FSANS, who provide some more technical support as well. So the executive has met 12 times since 2009. Generally it's twice a year. And what the executive does is make decisions about what food categories should be taken forward in terms of reformulation. It oversees the whole process, resolves issues, and identifies where we might go forward into the future. So the process itself is actually quite complex. The food reformulation process, there's basically 3 steps. The first step is around understanding the food categories. And what we do is we look at national consumption surveys and international reformulation initiatives and identify those foods that we believe are have the highest level of risk-associated nutrients and are also the most commonly consumed. The second level is actually collecting the data. So we divide the food categories that we've identified. So for example, if we identify soups as something that's commonly consumed but does have a high level, for example, of sodium, we divide that category into subcategories based on the nutrient makeup. So for soups, we might look at dried soup, canned soup as examples. And we collect all the nutritional information about those different subcategories, and that's collected through Aztec data. Then step 3 is that data has been used by the Heart Foundation to prepare some reports which identify market share and nutritional information, which helps us to understand where we should focus, who the major manufacturers are in that particular space. We then use the CSIRO, and I think Ingrid's going to talk a little bit more in the next bit about what the CSIRO do, but the CSIRO have helped us out looking at the technical restraints, including food safety issues, to determine what are realistic targets. So I think one of the things that has come out of previous discussions is it's not quite as simple as just saying, let's just halve the amount of salt or let's just halve the amount of fat. Formulating food is very complex and there's a balance between things. And I can remember someone telling me about a particular cereal manufacturer who was trying to reformulate something that was flakes, but the flakes kept falling apart because they were trying to take something out. So it's not that simple. It's a balance between the different nutrients, and there's a lot of technical work that has to be done to understand what you can and can't do in this space. So once we've actually identified what we want to take forward, we then move into the industry negotiation process. So the way that we've done this in the past is to have roundtables with industry in relation to the particular categories that we're looking at. So we have representation from manufacturers, retailers, distributors, importers. We talk about what the opportunities are, the issues around reformulation. As much as possible, we try to engage with those people who have the highest market share, because obviously they're the ones that can make the biggest difference. We use the information that we've gathered, the data, the work that the CSIRO have done, to actually start to talk to all of industry about what targets we can work towards. So the idea of the round table is that we can actually agree some targets and we can agree some timeframes moving forward. As part of the process, industry provide reports back to the department and we use those to monitor the progress. And one of the things that I think is very important is that this is company information. This is about reformulation of products that companies make and sell. And so a lot of the information is confidential. Two different breakfast cereal manufacturers are both trying to reformulate, and we want to make sure that they don't have access to each other's secret recipes. So we've also engaged with the quick service restaurant sector in this space as well, and recognising obviously that there is a difference between the quick service restaurant sector and other manufacturers and retailers in the food industry space. And the quick service restaurant members have committed to working in this space around a number of different things. Kitchen practices, procurement, so how they procure the ingredients that meet the reformulation targets that we're working on. So, for example, cheese for hamburgers, portion sizing and consumer messaging. So we're still only in the early stages with the quick service restaurant sector, but the fact that they're engaging, I think it's a real opportunity for us to do more in this space. So, to date, what have we worked on? So there's 9 food categories that we have identified and worked on. Of those 9, 9 of them we've looked at sodium and set sodium targets, and for one of them, processed meats, we've also looked at saturated fat targets. And for anyone who wants to see the detail of the actual targets that we've set, it's all available on the Food Health Dialogue website, so you can actually see for each of those categories what targets we've set. And I think it's important at this point to note there were some comments made in the discussion before about we should be focusing more on core foods and not processed foods, and why are we spending this time worrying about reformulation. If you actually look at that list, a number of things on that list are actually core foods in the Australian Dietary Guidelines. So bread and breakfast cereals, cheeses, they're core foods. So in focusing on reformulation, we are focusing on things that we are telling people to eat as well. So in terms of what the impact has been of the dialogues work, we got FSANZ to do some modelling for us to look at some of the benefits of reformulation, and we looked at the first 4 categories that we worked on. So we looked at breads, breakfast cereals, simmer sauces and processed meats. And the work that FSANZ did indicated that approximately 2,200 tonnes of salt can be removed from the food supply for those first 4 categories every year. So obviously we can expect as we do more work in this space that number will increase, but that's fairly significant, I would have thought. So in terms of the work that we've done to date, what are its strengths? I think one of the strengths of the Food and Health Dialogue is the fact that it's voluntary. It means that everyone's coming to the table in good faith, that we're able to work together and negotiate together. We've talked a little bit here about some of the conflicting priorities that there are out there. I mean, obviously industry's there to make money for its shareholders. It has to sell food. Those of us who have more of a public health bent are very focused on making sure that people eat properly, and we don't want them to buy the things that industry is trying to sell to them. So part of this voluntary process has been trying to negotiate, work together to come up with solutions to this problem together. And I mean, as we all know in this space, it's not easy. It's always problematic when you've got conflicts. But there is absolutely no way we're going to be able to fix this if we don't work together. And I know a number of people have talked about, well, why don't we just regulate? Unfortunately, regulation isn't simple and it's not the answer to everything. And I guess I can comment because it's not hidden in any way. That certainly the current Commonwealth government does not believe in regulation, in fact has a very conscious deregulation agenda. So certainly over the next few years, regulation is not going to be in the forefront in this space. So we do need to be continuing to think about how we can take things forward voluntarily. So the process, as I said, it does support industry to make realistic changes, and it supports industry to make changes that also work for the consumer. I mean, one of the challenges is, and I know this because I've seen this with people that I go shopping with, it's quite often if people see, for example, a sauce on the shelf that says low in salt, they won't buy it because they think, well, that one won't taste as good. So part of the reformulation agenda has to be, and this sounds awful, but doing it surreptitiously so people don't notice, so that they don't think this doesn't taste any good anymore, I'm going to change to something that's got more yucky stuff in it because it tastes better. But just gradually moving people to other products by gradually reformulating, not making big bang changes. And as part of that, we will improve the Australian diets. And as I say, I think Fazance's modelling is showing that we are in this space. Some of the challenges, though, I mean, it's never simple. And one of the issues that we have is around engaging with manufacturers of imported products. We get a lot of imported product into Australia, and particularly in some categories there's very high market share. So an example is instant noodles. So how we engage with the manufacturers that are bringing in products into Australia is a lot more challenging, and especially in terms of the voluntary nature of the dialogue, because it's very difficult to engage in that space. The other challenge or gap for us has been that there has been a limited focus on making multi-nutrient changes. So we're either focused on sodium or we're focused on sat, fat, but we haven't focused, for example, on sodium, sat, fat, sugar, like everything within a product. And one of the reasons for that is the technological constraints that I talked about before, and about how you balance things within a food product. And the other issue that has been particularly challenging in this space is the lengthy negotiation process. It has taken us a long time. I mean, one of the things about it being voluntary, about trying to work on more of a consensus basis, is even things like agreeing targets has been very challenging. You know, try and get a group of people in a room and get them to agree anything. It's always challenging. And it has taken us a very long time. And I think of everything, that's probably been the greatest criticism of the dialogue process to date, is the time that it has taken. Having said that, there are opportunities for us moving forward. Hastening the pace, obviously, I mean, it's the opposite of the downsides, isn't it? If there are ways that we could do this more quickly, I think that's a real opportunity for us, and expanding it to some of the other nutrients. I think one of the ways that we can actually make things happen more quickly is to look at how we can simplify the process. The process of identifying things, coming up with agreed targets, is very protracted. And certainly looking at what they've done in the UK, their process is a lot simpler, and I think there are some things that we can learn there. And then the last thing, which I think is a real opportunity in this space, is when the dialogue was originally set up, it had 3 areas of focus. The first was reformulation, the second was portion sizing, and the third was consumer messaging. We really have only focused on the first, and I think there's some real opportunities moving forward to focus on the other two. And we have talked a fair bit today about portion sizing and what we can do in that space. So I think that's something that we can certainly look at moving forward. So as I mentioned earlier, there is information on the website. There's a lot more detail, and the address is up there. So if you want to look at things like the current food categories we're working on, what the targets are, all that information is there. Thank you.
Thank you, Ingrid. I'm not going to be universally popular here, but we're not going to have time to go to audience questions after those because we're running slightly behind. I do want to ask you one quick question. Kathy, if you could come forward to the microphone and just answer this question that I'm asking of you, because I think it's on a few people's minds. You explained there how that process is a protracted one at your end, and there's been, some people haven't been happy with the pace that the dialogue's going along, but it's picking up a bit of steam now. What can New South Wales best do to be more involved and continue to push along the food dialogue?
Okay, it's not quite that simple. How do I put this? Everyone's aware we've had a change of government at the Commonwealth level, and as part of that process, the Commonwealth government is looking at everything that it's doing and reprioritising and deciding what it wants to focus on and what it doesn't. So in terms of the food and health dialogue, that's in the mix as part of that process. So we don't actually know at this point how we're going to move forward with the food and health dialogue. We've put forward a number of different options, some of which, can I say, are to make it bigger, better, more exciting. But we haven't yet got feedback back. So I guess from my perspective at this point in time, I don't like to use the word lobbying, but if people have views about how they would like the food and health dialogue to go forward and how important it is, I think it's really important that the Commonwealth Government hears those messages, and that's in terms of the New South Wales Government as well. If it's something that it believes it's important to take forward, I think it's really important that those messages get heard, because everything's up for grabs, as people would realise.
Very well said. Thank you very much, Kathy. I think we hear what you are saying.